The Civil Defense Commission's role and mandate has broadened over the years to cater for a widened focus on disaster risk management, inclusive of preparedness, response, mitigation, and recovery. But the CDC Director General, Lieutenant Colonel Kester Craig, says the regions are being targeted to equip authorities there to do much of the same work as the CDC.
And we have developed multi-hazard preparedness and response plan for most of the regions. By the end of the year, all of the regions except for Region 4 would have their own multi-hazard preparedness and response plan. At the regional level too, we have what's called a Regional Disaster Risk Management Committee that's headed by the regional chairman and have membership from all the stakeholders that are working at the regional level. And they have the responsibility to plan and also respond to disasters.
According to Colonel Craig, there is a general system that is in place which lays out roles and responsibilities of all the different agencies. He says that in terms of a disaster risk management system, this means working from community levels right up to the level of the cabinet.
Which includes all the communities, working with all the embassies, working with all the municipalities, working with the Regional Democratic Council, all the ministries, all the departments. So our work, it could be a response to health hazard, it could be a response to oil spill, it could be a response to tremor, it could be a response to eruption, any type of hazard impact. It's not disaster, hazard impact. We have a role to play. So our task is huge.
He also explained that the impact of most disasters is similar and result in the destruction of properties, injuries, loss of lives, and that's why at the national level there is a multi-hazard response plan. The CDC Director General added that a lot of work has to be done at the community level, mainly because whenever there is a disaster or hazard impact, it is a community that is the first to be affected, and that's why the capacities of communities need to be built and boosted.
So we started at several remote communities which are more vulnerable, putting those systems in place. So when something happened, the region, the community, they have the first responsibility to respond. When their capacity is overwhelmed, that's when it becomes a disaster for different levels, and that's when the CDC comes into play. But at the moment, since the system at the regional level and the community levels are new, what we're doing is more working closely with them to see that they can get the response up to that level.
Reporting for HGP Nightly News, I am Kristen Macklingam.